It's time for a Wellness Revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctorate.
Now, Dr. Stephen Hotze. Dr. Hotze's Wellness Revolution podcast is brought to you by Physicians Preference Pharmacy, formerly Hotze Pharmacy.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. We've got a great guest for you today. Steve Martinez, not only is he a great friend of Dr. Hotze's, great colleague, he has an awesome story to share. One that involves exosomes, which that might be not familiar to everybody, but we have started offering it at our center, and we're so excited to have him here on board sharing his story. Dr. Hotze.
Thank you so much, Stacey, and thank you for joining us today on Dr. Hotze's Wellness Revolution. I believe that you and everybody needs to have a physician and a staff of professionals who have the know-how and the wherewithal to coach you on a path of health and wellness naturally without pharmaceutical drugs. So as you mature, you've got energy, you've got vitality, and you've got enthusiasm for life. Wouldn't you like to live that way? Well, I know that a lot of people have problems that keep them from being energetic and full of vitality, and they're not enthusiastic. They're discouraged because they have significant joint pains. They have either knee degenerative arthritis in their knees and in their hips. Some may have even had some artificial limbs put in, artificial knees and hips put in. Other people have severe back problems or neck problems in their spine. And we're going to talk today about a wonderful new therapy that can be used to help your body overcome those naturally without having to get replacements, without having to undergo surgery. That's the goal. Wouldn't it be better to heal your joints naturally than to have them removed and put in a prosthetic knee or prosthetic hip? Of course it would. Well, at the Hotze Health and Wellness Center, we're now incorporating regenerative medicine into our treatment programs. Regenerative medicine is a natural approach to activating our cells to repair tissues and organs to establish normal function. At the Hotze Health and Wellness Center, we have decided to do stem cell exosome therapy. Now, let me explain this. God has given your body amazing restorative powers, a natural ability to heal itself. My dad used to say, son, God's given the body amazing abilities to heal itself, and he has. Oftentimes, we rush to the doctor for drugs or surgery when a tincture of time would heal problems. But some problems need to be addressed medically through either natural approaches for hormone therapy, a proper eating program, replenishment of vitamins, allergy treatment. Others need procedures. And the procedures we're going to talk about today are the problems that affect people that have degenerative joint disease. So this would apply to people that have arthritis of the knee, chronic obstructive pulmonary disease, Alzheimer's disease, traumatic brain injury. And stem cell therapy involves exosome treatment. Now, exosomes are nano-sized particles. That means they're microscopic, very, very small particles in the vesicles of our cells in our body. And they play a key role in having cells communicate with one another to know how to repair. Exosomes are biologically active molecules which create an environment where the injured tissue can regenerate, can rejuvenate, can repair itself. They enhance the viability and the activity of the power plants in the cell, the generator. The mitochondria is what it's called in medical terms. These power plants are contained in every cell, and exosomes can be given intravenously or directly into the joints to stimulate the regenerative power of cells in your joints. Stem cells have been shown to have therapeutic benefits and effect in the treatment of pain and joint management, immune system modulation, tissue and organ repair, autism, aesthetics and hair restoration, dementia, and holistic revitalization of the cellular processes. Over the past several years, I've been extremely interested in offering stem cell treatment to our guests. However, the FDA, the Food and Drug Administration, prohibits the most beneficial stem cell therapy. Prior to 2014, stem cell companies could harvest stem cells from mesenchymal tissue, that's fat tissue, or from bone marrow, and then put them in a medium where they would expand, in other words, and grow into hundreds and millions of stem cells. These stem cells were then given intravenously or directly into the patient's joints. This is what the FDA has prohibited. People have to travel now outside the country to obtain this treatment, which is very expensive and very inconvenient. This is why exosome treatment is so very exciting. It allows us to give you the benefit of stem cell therapy by using exosomes, which are biologically active molecules produced by stem cells. And this also makes it very cost-effective and very affordable and very convenient. Let me give you an analogy that will help you understand the relationship between stem cells and the exosomes produced by the stem cells. There are many oil refineries that line the Gulf Coast. Crude oil is refined into various petrochemical products at the refineries, products such as gasoline, diesel, butane, and propane. These products are then shipped to the various industries that use these products. When you pull up to a gas station, you fill up your car with gasoline that was produced at the refinery. Think of a stem cell as the refinery, and think of the exosomes as the gasoline you put in your car. There are scores of articles in the medical journals about the regenerative health benefits of exosomes. The more I've studied exosomes, the more excited I have become about offering exosome treatment to our guests at the Hotze Health and Wellness Center. They're truly a catalyst for whole body health. Let me give you some key points about the exosomes that we'll be using for treatment here at the Hotze, that we do use for treatment here at the Hotze Health and Wellness Center. Exosomes are derived from placentas of full-term live C-section births, and they are donated by consenting mothers who have passed a comprehensive medical background and blood screening test. They are purchased from an FDA-registered tissue bank that I have personally visited. Secondly, third-party testing is done on every batch, specifically for sterility and characterization of the exosomes, the biologically active molecules that are produced by the stem cells. A new placenta is used for every batch of exosomes to produce the highest potency. Our treatment contains the highest quality of exosomes and the highest quantity for effectiveness. For example, for knee treatment, each injection contains 50 to 30 billion exosomes. Intravenous treatment contains approximately 75 million exosomes. I've been extremely enthusiastic about incorporating exosome treatment into our health and wellness program. It has shown great potential for allowing individuals to have an additional way to improve and to restore their health. And today we have Steve Martinez, who's a physician's assistant and has a practice down in the valley, down in you're in
McAllen, Texas.
McAllen, Texas. And Steve's been a friend of ours, and I've known Steve, and he came to me and said, I know you're doing exosome therapy. I've had some significant back problems which are really inhibiting my ability to be productive. Now, Steve, how old are you now?
I am 38.
Okay. So tell us about your back and your back injuries, how they occurred, and what you have done in trying to treat these over the last several years.
Yeah, absolutely. And I first just want to start off, Dr. Hotze, is thank you so much for the invite. It's a blessing and a pleasure to be with you this morning. And I think that this message that we're going to be talking about today is something that is very important. Not many people know about, but at the same time can benefit so many people out there who are lost and searching for answers. And especially when it comes to lower back pain or back pain in general, because that's one of the most common complications in health and in medicine that people deal with, and trying to find and discover routines and therapies to help you not just cover up, but to recover is something that's very challenging at times. And my journey started in 2005. I'm a veteran of the United States Air Force. And in 2005, I was in a training exercise. And what we were doing was we were rucking. Pretty much we had our large 50-pound packs on, and we were all running in formation. And it was I was in San Antonio at the time, and it was about 4 or 5 o'clock in the morning, pitch black out, and we were running in formation down a hill. And unfortunately, as we were running in formation, I didn't see a hole in the ground. So my right foot stepped in that hole, and the momentum of us marching and the weight of my pack carried me forward, and my body rotated to the right.
Ouch.
Unfortunately, my foot and my leg and remained stationary in place in that hole, and everything just rotated like 180 degrees. And it was like bubble paper, pop, 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 and I just ruptured my lower lumbar.
Oh my goodness. Unfortunately,
I was able to stick it out in the training for 2 more days, but I couldn't feel my lower body, especially my right leg. It was completely numb. And it was almost, I tell people, it was like a Gumby leg. It was just kind of flopping around. And they eliminated me from the program. And, upon evaluation with MRIs and everything, I had a large rupture. I had about a 9 millimeter rupture on my L4, L5. And I also had about a 6 on L3, L4, and about a 4 millimeter on L5, S1. So my lower lumbar was just very tight, very impacted, very inflamed too, because it was just so much pressure on that thecal sac. My spinal canal was near none. And so since that time, I've experienced a lot of pain throughout the years, and I've done well as far as recovery, trying to get myself literally back on my feet, anywhere from different types of exercises, stretching, core work, chiropractic work, yoga, things like that. And it was getting me by. It wasn't something that took the pain 100% away, but it was getting me by. And then finally in 2016, I couldn't deal with it anymore. I actually went in to have a procedure done. It was called microdiscectomy. So where they actually take out piece of the discs that were impinging on my spinal column, and I got relief. I'll be honest with you, I got relief. I felt good. I didn't feel 100%, but I felt better. I was able to get back to my normal daily functions. And that was in 2016. And then unfortunately, before I came to you, Dr. Hotze, in November of 2019 is when I had a re-rupture. And it was miserable. And like I said, I've lived with chronic pain, off and on since 2005. But when I re-ruptured my discs in November of 2019, this was like a pain I've never experienced before, because it was 24/7. It was just not going away. I had a hard time eating. I had a hard time sleeping. I couldn't walk. I couldn't sit. I couldn't lay on my stomach, lay on my back. I couldn't have a bowel movement. I had like one bowel movement a week. I mean, it was just something that everything was just so tight, and so just my cortisol levels were through the roof. I knew they were. And I couldn't do everyday things. I couldn't put on my shoes. I had a hard time getting in the shower. I couldn't play with my little 4-year-old boy. I couldn't do these things. And it just crushed me. It crushed me to a point where I was like, I could honestly see, working with a lot of veterans, and the VA put me in like pain management classes to help me out. And I was with a group of veterans from Vietnam to the Gulf War. And for the first time in my life, I could honestly see how someone could literally go crazy from pain, because I could not escape. There was no escape. Everything I did, the pain increased. So it gave me a newfound respect for those who have these chronic illnesses, whether it be pain, anxiety, depression, or whatever. When someone feels trapped and there's no hope, that is where I've learned something. I've grown in that direction. I'm very thankful for it as well, but I'm also thankful for feeling a lot better now too. So I can't dismiss that. But
well,
like I said,
let me just underscore a point that you make with that excruciating back pain that you had. And I've had that too. I had some degenerative changes in my neck, and I had a unbelievable pinched nerve in my neck that radiated into my shoulder, and my shoulder went numb. I had to sleep sitting up. I literally walked around the house and said, God, take the pain away or take me home. It was excruciating. And I could see how individuals like you, similar to you, like the pain you experienced, they get hooked on these pain medications. And And then a lot of people get condemned. Oh, they're on all this pain medication. Well, if that's the only thing that gives you relief, you can see how people become addicted to those because the pain is so excruciating that you feel like you'd be better dead than alive. And that's a terrible amount of pain. And you had that all the time, consistently, day in and day out.
Yeah, it wasn't going away. It literally just kind of took over my life. And like I said, I felt trapped. I didn't know what else to do. And even I had so much, my discs were so desiccated, meaning just they were dry, they were brittle. And even the surgeon told me after my procedure in 2016, he says, when I was taking out the herniation, it was like crackers. They were just crumbling because my discs were so dry. And so again, when I re-ruptured it, I was like, I'll probably need to have another surgery. There's no other hope. Nothing, no pain medications was touching it, no stretching, nothing was helping me. I was like, well, the only other option is just surgery. And at that time, I was 38, and I was like, another surgery before I'm 40. I was like, this is not the direction I want to go.
So I was to be discouraging.
Yeah, I was definitely searching for answers, and learning more about exosome therapy, stem cell therapy, regeneration therapies. That's what really got me excited, and that's when I reached out.
So you came in here, and how long has it been since you underwent exosome therapy? And by the way, we injected in his L4, L5, that's lumbar vertebrae, L4, L5. Remember the spinal cord, you have the cervical spine, 7, then you've got the thoracic spine, 12 discs, and then you have the lumbar spine with 5, L1, L5, and then you have the sacrum. So this was down at L4, L5. This is in the lower back, and many, many people, as you mentioned, this is a very, very common problem in pain management that people see this terrible back pain. That's why chiropractors are busy all the time trying to help people get adjusted because they have subluxation and they've got problems. But your problem was more than just subluxation. It was a ruptured disc. Okay. So you came in how many months ago?
It was about going on 3 months, about maybe 3.5 months, actually.
And we injected into the L4, L5 region of the lower back with exosomes, somewhere on the order of 1 to 1.5 cc's, and then we gave you intravenous exosomes as well. So this has been 3 months now. So tell us the course, how your back is done over the last 3 months, and kind of take us through, the first couple of weeks, the first month, second month, third month. You have obtained relief, right?
Absolutely.
Well, so how did that? When did that? How did it start? So you had your therapy, and tell us about what happened then over the next 3 months.
Sure, absolutely. So the first maybe 10 days or 2 weeks, I'll be honest, I didn't really feel much of a change. And then slowly things started coming back. It wasn't like a light switch where everything just, voila, everything's back to normal. But slowly and progressively, I was regaining my life back in little ways. I was able to maybe have a few more degrees touching my toes or attempting to touch my toes to put on my socks or tie my shoes, or it was easier to get in to the shower or dress myself. These are things that were taken away from me. And so these little victories that I was able to have on a daily basis is what was really encouraging and gave me optimism, because even though 3 months isn't 3 years or 30 years, it was 3 months for feeling lost can really take a toll on someone's mental well-being. So these little victories were really motivating me to say, okay, what's next? And so it was pretty much month by month. So after month 1, I was able to walk without pain. I noticed my body composition when I looked in the mirror. My hips weren't crooked anymore because the spasms were starting to go down. And then on month 2, that's when I started to do different things. Like maybe I was able to lay on my stomach and do maybe some different types of stretches. I was able to get a whole night's sleep after the first month. I wasn't waking up with spasms, or when I twisted or turned in a certain direction, it'd wake me up because I would get severe pain going down my legs or in my toes, or I wasn't experiencing that anymore. And then after about, 2.5 months, then I started, hey, maybe I'll go for longer walks. Maybe I'll do a little bit of light body weight lunges or air squats, different things to, just to test my range of motions, test my movement. And I was able to do them. I was able to do them not only at that time during the activity, but I wasn't feeling the residual pain after I was done. I wasn't laid up for the next 2 days on my back because I couldn't move because of the pain after the exercise. So these little victories is what I've been noticing here and there. And then on month 3, that's when the magic was really made, because that's when I was like, okay, now I'm able to really go back and play with my little boy. I was able to cut the lawn, trim the trees, take it up a notch with my training exercises, maybe lifting some weights and things like that. So like I said, it's been a journey. I'm still not exactly where I want to be. I haven't, put on my running shoes and went out for a run yet, but I think I can. I'm just a little hesitant for myself, to tell you the truth, because I'm feeling so good and I don't want to disrupt the healing process. But from where I was day one, walking into your clinic, Dr. Hotze, to where I am now, it has been a complete life change. And literally, I feel like I've received my life back. And I'm able to be a dad again. I'm able to be a husband again. I'm able to be a clinician for my guests that I see here in the way I want. Because before, I was just overcome by pain. I couldn't think. I had a hard time speaking clearly because all I could think about was pain, 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 pain. And now, literally, I'm able to think clearly, to help my for treatments and diagnosis. I'm able to process these things more versus before I was just overwhelmed with pain all the time, and I wasn't able to function the way I wanted.
Well, that is a remarkable story. And I know there are many of you out there listening today that are experiencing very similar problems in your lower back, or you may have problems with degenerative arthritis in your knees. You've talked to your doctor and they say, well, we're going to have to do a knee replacement, or you've had problems in the hips and they're talking about hip replacements. I know so many people have had that. And a lot of people have this because at one time they were very active. They're runners and joggers, or maybe, and so they've injured themselves that way. I happen to believe that if you're going to run, please run on ground. Don't run on concrete. I just don't believe that even with the best shoes in the world, I don't believe God intended you to run on concrete. I think you ought to be running. If you're running or jogging, do it on land. That's the best way to do it. And if you really get into it, do it barefooted and you ground at the same time. And that's a whole nother story.
Absolutely.
But, this is a really remarkable story. Now, Steve, tell us a little bit about your practice down there, the type of practice you have. I know you practice natural approaches to health. Share with us a little about your practice down there in McAllen.
Absolutely. Well, it's a big thank you to you as being my mentor. So I can't thank you enough for helping this dream of mine come true. So I'm originally from Yakima, Washington, and I went to school at the University of Washington, School of Medicine. And when I graduated, I really felt called to serve those who needed the most. And so I looked for one of the most difficult places to practice in the country, and that was here in the Rio Grande Valley. I'd never been to the Rio Grande Valley. I'd never heard of McAllen before, but it was just something that I wanted to do. And so I packed up my little car, my little 94 Honda Accord, and just drove down. I was
very adventurous.
Exactly. Here I am, and let's get started. So, that's where my journey began. And as conventionally trained, I didn't know any better. And I thought, like, hey, if you have a pill for every ill, if you have blood pressure pill, cholesterol pill, anxiety pill, sleep issue pill. And like I said, I didn't know any better. But as I started to grow in medicine, as I started to read more, honestly, Dr. Hotze, after I picked up your book and, Hormones, Health, and Happiness, it's one of these things that I just grew. And I was like thinking to myself, there's more than we can do. And I've always felt, even though I didn't really, like I said, didn't know much different, I just felt we were too rushed in medicine. We weren't listening to the story of our patients. We were just, naming and blaming instead of thinking and linking to the problem. Because if we have symptoms that we're producing, there's something going on in our system that's producing the symptoms. So we need to get down to that root cause. If we don't, then what we're doing is we're creating an environment of dependence instead of independence. And that's not what anybody wants. We want to be in charge of our health. And what we're doing is we're preventing, or we're taking away that opportunity, in my opinion, from those we serve. So what I did was I just said, enough's enough. I just can't ethically and morally and spiritually practice this way anymore, because I was living functional. I was living the natural approach, but I was practicing in a different way, and it was tearing me up inside. So I told myself, I don't know how to start a clinic. I've never owned a business before. I don't know how to do it, but I'll figure it out day by day. And that's what I did. So I just kind of built this dream and just kind of put it into motion with a lot of help. I didn't do it on my own. And like I said, I can't thank you enough for the guidance you have given me, Dr. Hotze, to really bring a functional medicine practice to the Rio Grande Valley and offer these services that a lot of people were searching for, but they had nowhere else to go and they didn't know any different. So it's a big challenge, and we have a lot of work to do down here, but I'm very thankful for this opportunity and really listening to our guests' stories, because I think that story is so important. Once we learn about the individual, about what they're going through, what they tried, what they haven't tried, what worked, what hasn't worked, also their goals, their dreams, what they hope to achieve. These are the things that we want. These are the things that people want. And as a clinician, this is something I wanted to give to them, but I didn't have an opportunity to before because I was so rushed. But now, well, I get to run my own show now. So we take a lot of time, and we just really treat people, like human beings, like our family. And that's something I'm just so happy. And honestly, I don't even feel like I'm going to work anymore, because I just really love and enjoy what I do on an everyday basis. And I think this natural approach, people are very excited about. It's booming down here, and people are very enthusiastic to take control of their life, take control of their health in ways they may have not had, in opportunities they had before. So it's been a fun time.
Well, I want to congratulate you on building that practice down there and adopting natural approaches to health. For those that are listening that are down in the Valley area and anywhere else, really, tell us how we can contact you. Tell us your website, tell us your number, how people can contact you.
Sure, absolutely. Yeah. So the clinic, my clinic's name is Restore Wellness RGV, and our phone number is 956-683-6797. And our website is restorergv.com. And we're also on Facebook and Instagram as well. And we like I said, if anybody ever has any questions, we do offer just, free phone, quick phone consultations to answer anybody's questions, to see if we're a good match, to see if we can serve you in the way you're looking for. And so it's a huge blessing to be down here. It's a huge blessing to work with such great people and have the mentorship from the Hotze Health and Wellness Center. And it's definitely a dream come true. I'm very thankful for just being here and having this opportunity. So,
well, I want to congratulate you first for taking charge of your own life and of your medical practice, and having the desire to learn and to continue to question the current conventional status and look for opportunities that are natural, that help people really correct the underlying problems that create the symptoms. You say it so well. Right now in conventional medicine, it's a pill for every ill, an antidote for every problem, a Band-Aid for every symptom, masking the symptoms with drugs, which don't cure the underlying problem. So
absolutely.
I really commend you for the work that you've done and for taking initiative in your life, because I know, as you have found out, when you adopt these methods, you can help so many people restore their health, regenerate their lives, and get their lives back naturally without pharmaceutical drugs. Why do you do that? So they're alive again. So they've got vitality and enthusiasm for life, and that's what people want as you mature. There's no reason in the world, I don't care if you're 40, 50, 60, 70, 80, you shouldn't just be brimming with energy, full of vitality and enthusiasm for life. And so you've
Absolutely.
done that. And I also want to congratulate you on the success you've had with the exosomes. It's something that we've adopted in our practice here at the Hotze Health and Wellness Center, and we've had some really remarkable results. So for those of you, Stacy, tell our listening audience if you're interested in exosome treatment here, and let me just review for you what disorders it seems to benefit. And that would be pain and joint management, immune system modulation, tissue and organ repair, autism, aesthetics and hair restoration, dementia, and just a holistic revitalization of cellular processes. Remember, the exosomes are the bioactive molecules produced by stem cells. It's not the stem cells that morph into new, for instance, when you put stem cells into cartilage, the stem cells don't become chondrocytes. What the stem cells do is produce exosomes, which cause the current chondrocytes that are injured or ones that are uninjured to begin to reproduce collagen, so that you now, instead of having a bone on bone, now you've got a cartilage covering the bone, and that helps prevent the need for undergoing knee replacement or hip replacement. And of course, in people like Steve, people that have problems with their lower back, it can also modulate, it decreases inflammation, modulates the immune system, and this exosomes encourage the cells to regenerate and to rejuvenate. That means to get their youth back. So thanks so much for sharing this wonderful story with us, Steve.
Yes, thank you, Steve. And if you want to learn more,
pleasure.
Oh yeah, you're welcome. It's our pleasure. I mean, it's so blessed to hear about your story. I know others will be blessed to hear the story as well. And if those of you out there want to find out more information about this exciting therapy, exosomes, you can always call us at 281-698-8698. That's 281-698-8698. Thank you for joining us today at Dr. Hotze's Wellness Revolution.
A special thanks to Physicians Preference Pharmacy, formerly Hotze Pharmacy, proud sponsor of Dr. Hotze's Wellness Revolution podcast.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.